Well, the Southern African Alcohol Policy Alliance says the budget this week failed to do anything to address the harmful use of alcohol in the country. Now, the group feels that government did not use the opportunity offered by the 2020 budget to use fiscal measures to promote public health and reduce alcohol-related harm. For more, let's chat to Mr. Maurice Smithers. He's the National Coordinator for the Southern African Alcohol Policy Alliance. Good afternoon, Maurice. Always a pleasure to have you on the SABC News Desk.
Pleasure, thank you.
Maurice, before we get into it, a recent WHO report says that South Africans are some of the globe's heaviest drinkers. Why is that?
Well, I'm not sure what the reason is. Well, I suppose one can argue that the reason is why we're talking now is that government has not done enough to curtail the amount of drinking that is done. We have extensive advertising which encourages people to drink, glamorizes alcohol, normalizes alcohol, so we drink a lot. Some people say, you know, we're a very stressed country and that's why they drink a lot, but I don't think that's the reason. I think bottom line is that we don't have enough legislation to control the way in which alcohol is sold and produced in the country.
All right, so you feel the minister's budget speech really was a missed opportunity when it comes to addressing alcohol use. Tell us why.
Well, you know, normally when governments, and this is not South Africa only, when governments announce what they call excise taxes, they call them sin taxes. We actually object to the use of that term because it's a very moralistic term, it's a judgmental term. And we're not arguing that people should be judged for whether they drink or not. That's not the issue. The issue is how people are drinking and what responsibility society has for addressing that. Now, what a lot of people don't know is that excise tax, the term, the notion of excise tax globally is a tax specifically aimed at mass-consumed products which have either a health, social or environmental harmful impact on society. So the very purpose of the tax is to reduce alcohol harm. That didn't happen. The increase on beer, for example, was 8 cents on a can of beer. Now, a can of beer is around 8 rand if you buy it from a bottle store. Obviously, it's more if you buy it from a drinking establishment. That means it's a 1% increase. How is that 1% increase going to discourage people from drinking, consuming too much alcohol? It doesn't do it. It doesn't achieve it. So therefore, the excise tax is failing in its actual intention. The other thing is that what government could do is do what, for example, Thailand has done. Thailand has got a 2% surcharge on alcohol and other products, and they use that to promote health in the country. And not enough's been done about that. We've been told, for example, the health department has underspent by 10, 15 million rand on their health promotion budget. So even when government's got a budget, it doesn't actually do enough to promote a healthy way of life, which includes a reduction in the harmful use of alcohol.
Maurice, how would you then respond to those that argue that no matter how expensive we make alcohol or cigarettes or what is it, that they will find a way to pay for such substances and they will indulge because they want to do so? And it's more about raising awareness and conscientizing citizenry about how they actually indulge in these kind of substances.
You know, if you're a heavy drinker, and somebody comes along and wags a finger in your face and says you really should be drinking responsibly, why would anybody listen to them? You know, the reality is the World Health Organization has said that that awareness programs have no impact whatsoever unless they are backed by effective legislation. And they argue that the three things that you need, key things, one is you limit or ban alcohol advertising, because advertising encourages people to drink, it normalizes alcohol, it glamorizes alcohol. If you look at the kind of adverts they do, it makes alcohol look like a really cool thing to be doing. It's associated with celebrities, with sport, with culture, and so on. So ban alcohol advertising, number one. Number two is you have to reduce the availability of alcohol. So you reduce the number of outlets you have, and you reduce the operating hours. In a place like Brazil, for example, Diadema, there was a town in Sao Paulo, next to Sao Paulo, called Diadema. Now, Brazil has got no controls over alcohol, almost zero. And there were a very high murder rate in Diadema. They simply changed the operating hours to 11 o'clock at night, and the murder rate dropped dramatically. So you've got to actually reduce availability as well. The third thing is you use fiscal measures, and there's two ways you can do that. One is through excise tax, and the other is through introducing what they call minimum unit pricing, where you actually say that people cannot sell alcohol below a certain price. If you look at what happens, particularly around Christmas, the bargains, the discounts that the liquor industry gives you to encourage you to drink more. So you have to, Scotland has done it recently. Russia has done it. Now, you said earlier on, we're amongst the heaviest drinking country in the world. Russia used to compete with us for that. Russia has reduced alcohol consumption by 43% in the last 20 years. And one of the ways they did that was by introducing minimum unit pricing on spirits and various other mechanisms they used. One of the benefits of that is that the life expectancy rate in Russia has increased by almost 10 years. So you can see the immediate health benefits. So the responsibility lies with government. You can't, the liquor industry loves actually talking about their responsible drinking campaign. What they're doing is putting the responsibility on the individual. They're not taking responsibility themselves, and they never will, because their job is to sell alcohol. So government has got to step in. You can't let the liquor industry regulate themselves.
All right, when it comes, we've got a ban on cigarette advertorials right now. Why has the alcohol industry been slow to follow there? What are the delays that we're looking at?
I don't know. It's a very odd thing, because, you know, there's a very interesting, I want to show you, I don't know if people can see this. This is a very interesting
Go ahead, if we can get a close-up on that shot. Yes.
That is actually done in Britain in 2010. But what the graph shows in the blue and the red sections, the blue section is the harm done to individuals by a range of drugs. And the red is the harm done to society by those drugs. In other words, the person taking the drug, there's a certain risk to that person. That particular drug has an effect on the rest of society. Now, if you look at this, tobacco is over here. So yes, there is harm to society of tobacco, and that's one of the primary reasons why alcohol advertising was banned, because of secondary smoke. It was said that if people smoke, it has a negative impact on other people around them. Alcohol, if you look at this, and these are all drugs, and alcohol is a drug too. Alcohol has, first of all, got the highest level of harm of any drug in the world. And secondly, the harm to society, to the society around the drinkers, is higher only for alcohol, for no other drug. And that's why we find it astonishing that what drove government in 1999 to put massive restrictions on tobacco with enormous benefits for society, because today's non-smokers are able to exercise their right to a smoke-free environment. What we should be having is non-drinkers and drinkers themselves. Because remember, people who drink themselves are under threat from other drinkers. Because if you go to a bar to go and have a drink, or to a club to go and have a drink, you don't want to suddenly be faced with violence from some person who's actually used alcohol in a negative way. So we want to create a society where drinking, we're not saying ban drinking, although some people these days argue you should, because the increasing evidence says that alcohol, there is no benefit from drinking alcohol. In 2018, evidence showed that alcohol is linked to 7 types of cancer. And that's logical if you think about it. What is alcohol? Why do they say that when you are drunk you're intoxicated? Because you've introduced a toxin, a toxic substance into your body, which is the alcohol element of liquor. So the question is, how can we create a society where if people drink, if they choose to drink, it doesn't harm them personally, and it doesn't harm society around them through road crashes, gender-based violence. I mean, Becky Cele was talking earlier on at this funeral about violence. At the last year, he talked about gender violence. The president spoke about gender violence and said alcohol is directly linked to the levels of gender-based violence in South Africa.
Mr. Maurice Smithers, National Coordinator for the country's Alcohol Policy Alliance, thank you so much for sharing those invaluable insights with us right here on the SABC News Desk.